My name is Shoaib. I am an adult neurologist. I'm board certified in neurology, and I am subspecialty trained in cerebrovascular diseases and stroke. Well, the communication style with the patient is that one thing, coming to a doctor is a very anxiety-provoking thing for patients. So in my practice, what I try to do is to make the patients comfortable first. And my goal is to make them understand their disease. I've learned over years that when a patient understands their disease, they can easily cope up with it. So when I communicate with the patient, I do it in a very simple term, and I try that before they leave, their anxiety is relieved and they understand the disease. Some new technology that we are interested in is doing nuclear scans on the brain to determine the release of dopamine, which is the chemical that is deficient in Parkinson's disease. And in the past, we had no test to determine if somebody has Parkinson's disease or not if we were not sure. But now we can send them for this test, and it will tell us if the dopamine release is decreased, and that will be consistent with the diagnosis. When I decided to move to a bigger town, I wanted to live in a bigger town, but wanted to work in a hospital where I could still have a very close personal relationship with the patients. The referring physicians, I think one of the things is a challenge for them most of the time is that how to get patient in quickly, especially if the patient needs a specialist quickly. So I always tell my referring doctors, I give them my cell phone number and tell them to call me if they can't get the patient in my office quickly. And I make an effort to see the patient sometimes on the same day if I have to.